Good afternoon, ladies and gentlemen. Please note this first slide. This is a student presentation from UAMS. The information contained herein does not necessarily reflect the views of UAMS or any other agency. I want to thank you all for being here. My name is Dean Ezel. I'm an occupational health consultant from UAMS. It looks like we have a good group here today with some professional landscapers as well as home gardeners, farmers from all over the state, and quite a few construction workers. Even though you have different occupations, one thing that you all share in common is that you work outdoors. And working outdoors in Arkansas exposes you to some health risks. The ones we're going to talk about today, we're going to lump under the category of biological hazards or biological risks. And by biological hazard, I mean hazards that occur secondary to things that are alive. In other words, things that can bite you or sting you, animals that can infect you, and so forth. There are obviously quite a few of these, and we can only cover the most important and the most common ones, but we're going to lump them into the large categories of things that can poison you, things that can bite you, and things that can infect you. And as you will see, there's going to be quite a bit of overlap between these different categories. I'll begin by talking about the poisonous plants of Arkansas. Once again, there are very many of these, but I'll focus on the common ones: poison ivy, poison oak, poison sumac. These plants grow throughout the state as either small woody vines or small shrubs, sometimes larger shrubs in the case of poison sumac. The main problem with these plants occurs when they come in contact with bare skin, and they can cause a fairly significant skin reaction that includes redness, swelling, burning and itching, maybe blister formation, maybe papule formation. This can be particularly problematic if it involves the face or the eyes. Another problem with these plants occurs when this toxin is breathed into the lungs, and that can happen when they're burned. When burning brush or wood that may have poison ivy in it or be contaminated with poison ivy, this toxin can enter the smoke because it's not broken down by the fire, and then can be breathed into the lungs, where it can cause a fairly severe lung inflammation that can, in some cases, even be fatal. NIOSH recommends that workers who are burning brush or wood that may be contaminated with poison ivy wear respiratory protection to avoid breathing this toxin. They recommend an N95 face mask or equivalent, and some jobs actually require more stringent respiratory protection. We like to avoid problems with these plants by avoiding exposure. That means keeping the skin covered with clothing, long sleeves, long pants, gloves, hats, and so forth. The toxin can contaminate tools that are used, so these need to be cleaned with isopropyl or rubbing alcohol, since soap and water won't remove the toxin very well. Treatment is with conservative measures unless the symptoms are severe or involve uh, sensitive areas of the body like the eyes or face. If that be the case, then one would need to seek medical attention. Another hazard that we might encounter are insects that can sting us and inject venom. And again, there are very many of these, but I'm going to focus on wasps, yellow jackets, bees, and fire ants. These insects are very common and are found throughout the state. They like to build nests in old buildings, under roofs, in sheds, sometimes just in trees and shrubberies that may surround a work site. When they sting, they inject venom into the skin, and this produces a severe local reaction with redness, swelling, initially pain, later on itching. Sometimes they become secondarily infected. Treatment usually just involves conservative care with ice packs, cool compresses, and over-the-counter remedies. However, if the sting involves the face or the eyes or other sensitive body parts, then further treatment may be necessary and a person should seek medical attention. Now, there are some people who have a true allergic reaction to these insects, and that can be a much bigger problem because this allergic reaction can sometimes be life-threatening. We call this an anaphylactic reaction. The symptoms of this are hives, which are these raised, red, very itchy skin lesions. There can be respiratory problems with wheezing and sometimes even complete closure of the airway. Blood pressure can drop and can even lead to shock and possibly death. Obviously, then, this is a serious medical problem that needs immediate medical attention. If a person knows that they are allergic to these insects and is going to be working in an area where these insects are found, then you should be prepared to treat this allergic reaction if it occurs. If you're allergic to these insects, you should talk to your doctor about providing you with an epinephrine autoinjector, commonly called an EpiPen, but there are other devices that are similar, so that if you're stung, you can inject the epinephrine, reverse the symptoms of anaphylaxis for about 20 to 30 minutes, and provide time for you to get to the emergency department where definitive treatment can occur. Most of these auto-injectors have a second injection if the first one wears off before you reach medical care. Let your coworkers know about your allergy and where you keep your auto-injector. And NIOSH recommends that supervisors have one of these epinephrine auto-injectors available at the work site if their workers are going to be exposed or potentially exposed to these insects. Other things that can bite and inject venom are spiders. There are two types of venomous spiders in Arkansas, brown recluses and black widows. Both of these are shy creatures that avoid humans as much as they possibly can. They like to build their nests in cool, dark places such as under houses, under wood piles, in lumber piles, in old buildings, sometimes in clothing that's been left hanging for a while. They'll only bite when they feel threatened. Brown recluses have a painful bite that is rarely fatal but can cause significant skin breakdown, much like a large burn, and this requires medical attention. If you've been bitten or think you've been bitten by a brown recluse, you should seek medical attention. Black widows also avoid humans. They like to build their nests in much the same places as brown recluses. They also like outbuildings like outdoor toilets and privies. So in using the porta potties at the job site, you should look before you sit. The bite of the black widow is usually painless. The symptoms occur a few hours later, and because it's a nerve toxin, not a skin toxin, the symptoms are numbness, tingling, sometimes weakness, oftentimes intense pain, especially around the abdomen, and it can sometimes mimic things like appendicitis. A black widow bite is fairly serious. A person who is exposed to one of these and thinks they've been bitten should seek medical attention fairly quickly. Some other things that can bite you and inject venom are snakes. These pictures show the 4 venomous snakes of Arkansas: rattlesnakes, copperheads, water moccasins, and coral snakes. Snakes are found throughout Arkansas, although the coral snake is more commonly found in the Delta and in southwest Arkansas. There are also several species of non-venomous snakes in Arkansas, and these can also sometimes bite people. Although they don't inject venom, these bites can become secondarily infected and require medical treatment. Any snake bite should be taken seriously, and if it occurs, then seek medical attention right away, and don't try to determine if the snake that bit you was dangerous or not. Snakes like to hide where they can ambush their prey, so they hide in tall grass. They like to live under rocks, under buildings, and in other places around water and vegetation. You want to keep your job site clear of snake habitat. Keep the grass and the weeds and the vegetation cut down to make it less appealing to snakes. Keep your eyes open and watch for snakes when walking or working in areas where they may be found. Wear long pants, long sleeves, and thick work boots as well. If you are bitten by a snake, don't panic. Get to a safe place away from the snake. Don't try to catch the snake, but if you can get a look at it and later on describe it to your doctor, that'll be useful. Getting a cell phone picture would be even better, but don't waste time to do it, and don't risk another bite in getting a picture. Immediately alert someone if you're bitten. Let your coworkers or your supervisor know, or if you're alone, call 911. Don't cut and suck the snake bite. That only makes it worse. Don't put a tourniquet around it, and don't spit tobacco juice on it. Do stay calm. Wash the bite with soap and water and get to the emergency room as quickly as possible because snake bites require antivenom for definitive treatment. Ticks are another creature that bites frequently in Arkansas. As you know, they're all over the state, especially in warm weather. They don't inject venom, but they can inject microorganisms that can cause disease, such as Rocky Mountain spotted fever. Rocky Mountain spotted fever occurs fairly commonly in Arkansas. There were 1,029 cases last year. Most years, about 1,000 cases. You can see from the map that Arkansas is kind of in the heart of the Rocky Mountain spotted fever belt in the United States. Symptoms are pretty severe usually: high fever, headache, muscle pain, and a rash that begins on the hands and feet and works its way up the arms and legs. Some people can become very ill, so if you've been exposed to a tick and develop any of these symptoms, you should seek medical attention right away. Tularemia is another tick-borne disease in Arkansas. Sometimes it's called rabbit fever. It can also be spread by deer flies and by handling the carcass of an infected animal. Last year there were only 70 cases in Arkansas, but as you can see from the map, the epicenter of tularemia in the United States is in Arkansas and Oklahoma. This is another disease that can make you quite ill, and if you've been bitten by a tick and have symptoms such as a sore that won't heal, enlarged lymph nodes, fever, pneumonia, then you should seek medical attention so that you can get appropriate treatment. I mentioned Lyme disease, even though it's not terribly common in Arkansas. We talk about it a lot. Last year, there were only 4 confirmed cases in the state. Symptoms are nonspecific and mimic the flu with fever, headache, and muscle pains, but the rash that the tick bite causes is fairly significant and fairly unique. It's called a target or a bullseye rash, and as you can see from the picture, that's precisely what it looks like. We call it erythema multiforme. If you've been bitten by a tick and have this characteristic rash, you should go to your doctor and get checked for Lyme disease. Lyme disease can be treated fairly easily early on, but it's much harder to treat when it becomes chronic. Avoid tick-borne illnesses by avoiding ticks. Wear protective clothing, long sleeves, long pants tucked into boots, hats, gloves, and so forth when working in areas where ticks are found. Use insect repellent on exposed skin as well as clothing. Permethrin treated clothing will prevent and kill ticks that get on the clothing. When ticks get on the skin and embed themselves, remove them as soon as you find them. The sooner a tick is removed, the less chance it has of injecting the microorganisms that cause disease. Keep your work site clear of tick habitat. Keep the tall grass and the weeds cut back and make it less attractive to ticks and therefore less likely that tick exposure will occur. Some animals can transmit disease, in particular rabies. Rabies is transmitted by warm-blooded animals. There aren't very many human rabies cases in Arkansas. The last one occurred a few years ago, but each year there are quite a few animal rabies cases. We avoid rabies by avoiding the animal vectors. We stay away from skunks and bats. We avoid animals that are behaving abnormally. If one is exposed to rabies, seek medical attention right away because the vaccination series that prevents rabies needs to be started early. If your job or your avocation carries you into places like caves where you may have contact with bats, then you should talk to your doctor about a pre-exposure rabies vaccination. Farm animals can transmit some diseases like anthrax and brucella, but these are uncommon. Last year there were only 4 cases of brucellosis. We're exposed to these diseases usually by slaughtering or handling animals that are exposed. Interestingly, feral hogs that are such a problem in Arkansas are a fairly common source of exposure to brucellosis. Other infections can be spread from dead wood and the soil and dead leaves that litter the ground, such as histoplasma and blastomycosis. Sporotrichosis is a fungal infection that can occur after a prick from a thorn, such as from a rose bush. Birds and bird droppings can sometimes be the source of infections like psittacosis or histoplasma. Tetanus is another thing to think about when outdoors in Arkansas. The bacteria that causes tetanus and the spores that it leaves behind are very commonly found in the soil throughout the state. Any small cut or abrasion or insect bite even can become contaminated with these spores, creating the risk for tetanus. Tetanus is best avoided by keeping your tetanus vaccination up to date. A person needs a tetanus booster about every 10 years. Talk to your doctor about any other vaccinations that you might need when you go in for your tetanus booster. Many of the things we've described in the preceding slides, if they occur on the job or at the work site, will need to be reported to some agency. Supervisors should be aware of their company's policies and procedures regarding what needs to be reported and to whom. This slide has some useful contact information if you have questions or need more information about any of the things we've just discussed. These next two slides are a list of the references I used in putting these slides together and are also very good sources of further information if you want to learn more about any of the things that we've talked about. Thank you for your kind attention, and I'll open the floor for any questions.